We're reacting to an old documentary from 1979,
Doctor of Chiropractic,
showing its clash with the medical field.
Keeping these bones in their proper relationships to each other.
It's important to address the concepts presented in this video.
Adjust the vertebra back into place.
Because, unfortunately, many chiropractors in the United States still use these principles today.
Then the entire body suffers and resistance is lowered.
Furthermore, you may have even heard similar ideas during a recent experience with a chiropractor.
Try and maintain good nerve supply to all of the organs so they can function properly.
Stick with me as we dive into topics around alternative chiropractic medicine, examining long-standing beliefs and breaking down the reasoning behind traditional chiropractic practices.
I wanted to say that I got a letter on November the 3rd of 1978, and it says, "Dear Mr. Trotter, does anybody out there know that there are alternatives to doctors, hospitals, nursing homes, and rising medical costs? How many of your viewers are aware that chiropractic..."
When no one is there to serve those left behind by the traditional healthcare system for whom conventional medicine offers no meaningful answers,
foremost function is preventive health care.
Another therapist, whether called an idiopath or something else to describe a new profession, will step in,
Not treating necessarily whiplash and an aching back.
awkwardly fill in the gap with miracle cures and questionable pseudoscientific explanations to improve these individuals' quality of life.
Well, got the letter from the Association of Chiropractic Education, and we are here this evening. Our first guest is Dr. Terry Ronberg, the author of that letter. He's president of the Association for Chiropractic Education.
While I understand the role of associations,
Of the Association for Chiropractic Education,
the public also needs regulatory bodies to ensure proper oversight.
and is a doctor of chiropractic.
It's important to remember that in the 1960s, the title Doctor of Chiropractic
Dr. Terry Ronberg
carried a highly dubious reputation. At that time, chiropractic education was exclusively provided by private schools, unaffiliated with any government oversight, each with its own curriculum, training, and standards. It was far removed from a doctoral degree
Dr. Terry
one might find in a university setting. Thus, calling early practitioners
Doctor
was misleading during the initial development of chiropractic in North America. Chiropractic could have instead begun as a profession of therapists referred to as chiropractors and evolved over the years through the establishment of regulatory bodies and a standardized university-level curriculum. This would have allowed chiropractors to legitimately earn the title
Doctor,
much like dentists earn a doctor of dentistry and psychologists a doctor of psychology. A clear distinction between doctor as a profession and doctor as a medical title would have been beneficial, ensuring public transparency and avoiding confusion between healthcare providers and medical doctors.
Terry, I think I would like to ask you, what is chiropractic?
Well, to answer that, I think it's essential to have an understanding of what chiropractic is not. Chiropractic is not a diagnosis or a treatment for any disease or any symptom in any way at any time.
It's important to understand why he's saying it this way. Perhaps chiropractors at the time didn't fully grasp the level of indoctrination that the religion of chiropractic instilled during their training. It's as though, back then, chiropractic students were just repeating words, almost like reciting lines from the Bible after a sermon, without really understanding or questioning why they were saying these things. He's speaking in a way that suggests he learned it by heart in school. One likely reason chiropractic schools trained practitioners to define chiropractic in this way was to avoid charges or prosecution for the unlicensed practice of medicine. By positioning it solely as a method for wellness, prevention, or optimal health, and by avoiding claims of curing or directly treating conditions, they sidestepped legal issues that might have arisen if they had explicitly claimed to treat medical conditions. We still see this tactic today with products like Super Patch and natural health products that include disclaimers on their packaging and websites stating that the product is not intended to treat, cure, or prevent any disease and has not been approved by the FDA. In essence, when a wellness company wants to sell a product and makes impressive, wide-ranging health claims, they need to include disclaimers to protect themselves from potential lawsuits.
And I think that the vast majority of people do not understand what chiropractic is or what it's for. Chiropractic is for the restoration and maintenance of health.
Okay, I have a brochure, and it is from your organization. It says people come here for 4 main reasons: disease, prevention, improving themselves, and improving the world. Can the medical world offer the same thing, in your opinion, Dr. Jerome Williams?
Oh, very definitely so. I am still not quite clear as to what the practice of chiropractic actually is. And I think this will be a learning situation for everybody.
Back then, chiropractors had far more to gain by focusing on what chiropractic wasn't rather than clearly defining what it was, as this helped them avoid legal action for practicing medicine without a license. A precise definition would have restricted the scope of chiropractic, limiting them from treating patients with a broad range of health issues. Without a clear, specific definition, they had the freedom to see many patients for many different reasons, which increased the chances of producing results unrelated to the neuromusculoskeletal system.
Now, I would like to differentiate chiropractic from chiropody. The public probably gets those confused. The practice of chiropody or podiatrist actually is dealing with the feet or the foot itself. This goes back to 1840, and I think the chiropractics first started in 1895. I think they had David Palmer, who founded the organization in Davenport, Iowa, and he established the Palmer Institute or Palmer College of Chiropractic in 1898, and his son carried on the work. But I would like to hear more what the gentlemen have to say about exactly what they do, so then I can more intelligently comment on it.
Okay. Dr. Gold, you may continue with that by this specimen you brought in.
Okay, if I may borrow a little Willie here. This is a fiberglass model of the human spine seen here from behind. The hip bones or pelvis, the sacrum, tailbone at the bottom, then the 24 movable segments or vertebrae that form the spine, and on top of that, the skull. This, of course, is the province of the chiropractor. Chiropractic is based upon the intent of keeping these bones in their proper relationships to each other.
This belief still persists. Most chiropractors back then, and even some in the United States today, don't understand that anatomical variations in spinal positioning, like the distance between spinous or transverse processes, left-right rotation, or lateral flexion, are completely within normal limits. The spine has a functional design built to support you as you are today, and minor positional variations have never been scientifically correlated with health issues.
Simply because virtually every vital nerve trunk in the body passes through these openings. As we turn the spine sideways, we see openings between the bones, and inside the bones of the spine runs the spinal cord. Now, as long as these bones are in their proper relationships to each other, then all of the nerve trunks giving rise to all of the distribution of nerves throughout the body is in a normal, healthy condition. The nerve trunks are in a normal, healthy condition. If, however, one of these bones becomes misaligned from its fellows above and below, that's what the chiropractor calls a vertebral subluxation.
Unfortunately, this so-called misalignment, where one vertebra is out of place relative to another, has never been scientifically proven. Again, if we take X-rays, we might see anomalies or minor differences from one spine to another. But these have never been linked to actual health problems. The only cases where a nerve could be compressed, damaged, or irritated are those involving invasive spinal lesions, where something pushes into the spinal canal or the space between vertebrae, known as the intervertebral foramen, affecting the function of a nerve or the spinal cord. More commonly, this occurs with a herniated disc. But age-related advanced arthritis and osteophytes can also restrict the spinal cord and the nerves exiting the vertebrae, leading to neurological issues like loss of sensation, reflexes, or muscle strength.
A tiny twisting of the bone, which narrows the opening, damaging the nerves, and resulting in some malfunction or malfunctions at the organs at the end of the nerves. Now, the chiropractor's job is, as Dr. Ronberg pointed out earlier, is never to diagnose or treat disease. We're not in the disease-treating field. We merely point out that if the human body is to have any chance at all of functioning normally, then every nerve to every organ must be in normal condition.
So what, go ahead, I'm sorry.
So what we're doing then is examining the spine to find these subluxations, and we examine the spine with x-rays, with instruments, with our hands.
It's important to understand that a subluxation cannot be identified through x-rays, by touch, or with instruments. First and foremost, the subluxation is a myth. It's a chiropractic branding concept, a pseudoscientific idea that was introduced to create a trademark for spinal manipulations that existed long before chiropractic and its dubious association with subluxation. Through palpation, we may find segments that are more restricted in relation to pain, but that does not imply the existence of a subluxation. Additionally, segmental restrictions can be found between the neck, back, and lower back segments in patients who are completely asymptomatic and have no issues in those areas. That's why it's important to always ask whether there is a clinical justification for performing a manipulation in that region, especially since it's a more invasive therapy compared to simple soft tissue work, whether therapeutic or for relaxation. It's always crucial to remember to maximize benefits while minimizing risks as much as possible.
And if we find a subluxation, then we set about a program really of spinal rehabilitation.
I'm very familiar with chiropractic rehabilitation programs from those years. They were standard programs that chiropractors were encouraged to give to all their patients. It involved the same routine: chiropractic adjustments of the neck to the right and left, the thoracic region, up, middle, bottom, lower back, sacrum, left and right. It was a consistent routine. Chiropractors back then liked to say that their adjustment protocols were highly specific, but you could go from one chiropractor to another and receive the same protocol. Whether you came in for headaches, back pain, neck pain, gastrointestinal issues, ear infections, and so on, the approach was essentially the same.
Gradually, gently easing these bones back into their proper relationships.
That's actually quite funny because given the reputation of chiropractors during those years, there was nothing gentle about chiropractic manipulations. They were often forceful adjustments designed to make sure that you could hear the pops and cracks to satisfy the chiropractor's questionable beliefs and awkwardly confirm to the patients that a correction had been made.
Getting the openings back to normal size and allowing the nerves to function normally. And that's all.
Okay, in your, I could say, treatment of this, if someone has, let's say, a bad back, do you check that out before you go to twisting the nerve?
No, absolutely not.
Is that dangerous?
No, we will examine the spine to see, first of all, if there is or is not a vertebral subluxation.
I can guarantee that regardless of the condition, chiropractors will find areas that can be cracked and manipulated to produce audible pops. It's not very honest because any part of the spine can be cracked if enough force and movement are applied. So yes, a chiropractor could awkwardly say, "You have subluxations. Here, listen to the cracks in your neck, your back, your pelvis. I've corrected them, and I'm going to help your issue."
We really don't care what it's causing. We're quite satisfied that any time a nerve is damaged, then the entire body must suffer as a result.
You don't care what it's causing?
No, exactly. If there is a vertebral subluxation, whether we can find what it's causing, whether we know what it's causing or not, in and of itself, this vertebral subluxation limits the body's ability to function properly. It shouldn't be there.
I'm not sure if you catch the wordplay or the technique being used here, but the point isn't about actually treating something or caring about the patient's condition when they come into the clinic. All they want to do is find imaginary subluxations that will restore nerve flow, which is again pseudoscientific. As we've discussed, unless there's an invasive spinal lesion, the nerve flow or function is not affected.
So the next part of our examination is concerned with seeing whether it is safe for the chiropractor then to adjust the vertebra back into place.
And how does
All right, if there is a subluxation and it is safe to adjust it back into place, we do that, regardless of whether the patient has a backache, a cold, asthma, bronchitis, menstrual cramps. Doesn't matter what disease the patient does or doesn't have. What we're doing is not being done to cure disease. It's being done simply because every human being, with or without disease, is better off if they have a good nerve supply to all of the body.
You mean the twist of this could help a cold?
No, on the contrary, the twisting of that damages the body. Now, in this human body of ours, every single part is dependent upon every other part. You can't have a malfunctioning liver and the rest of the body healthy, or a malfunctioning kidney and the rest of the body healthy. If any part of the body has a damaged nerve supply, then the entire body suffers and resistance is lowered.
Once again, I'm not sure if you see the mental gymnastics at play here, but they use broad concepts and generalizations to maintain a consistent narrative. Unfortunately, the human body's homeostasis is incredibly adaptive to many changes. Unfortunately, despite this concept being true, the mental gymnastics lie in claiming that if we have these pseudoscientific subluxations and don't address them, the body's ability to maintain homeostasis and self-regulate becomes faulty or less effective. It's this dubious association that is dangerous and has been hidden under the radar.
A cold doesn't come from a single cause. You brought up cold. The same virus which will cause a cold in a person 1 week will not cause a cold in that same person a week earlier or a week later.
For the same virus, there are different versions or mutations that result in varying levels of virulence, and the body might be accustomed to one type or mutation of the virus. However, the immune system may not be prepared for other mutations. This explains why, with the flu, we might catch it one time and not another. It could be because the immune system is better equipped, or because we have more energy, are healthier, or our system is less weakened by fatigue, stress, etc. But once again, the argument is made that whether or not we get affected by the flu virus depends on whether or not we have subluxations. We're caught in mental gymnastics attempting to link chiropractic subluxations to the idea that if they are not treated, we are either better or less equipped to handle diseases like the flu.
We're dealing with two factors. One, the environmental factor, the other, the resistance of the body. Now, chiropractors deal with the resistance of the body in that we try and maintain good nerve supply to all of the organs so they can function properly.
It sounds good, it seems logical, and it appears coherent, but unfortunately, there is no scientific evidence, and there still isn't any to support this kind of rhetoric. In theory, it sounds nice. In practice, it doesn't work. Always remember that when health claims seem miraculous, they require miraculous evidence to back them up. Otherwise, they are just empty words, meaningless, and exist solely to take money from the most vulnerable and those neglected by the traditional healthcare system.
It is an inevitable fact that if one organ is damaged because its nerve supply is damaged by these spinal subluxations, then the entire body malfunctions. Could eventually lead to some disease, could not lead to disease. Mostly, if it were involved in disease at all, it would be as a contributory factor. Diseases don't come from a single cause.
Okay, doctor, I come to you, let's use me for an example, and I tell you that I have a terrible sinus infection, upper respiratory infection, and I'm not going to a medical doctor, I'm coming to you.
Beautiful. This is what usually happens. You come to me and say, Reggie, can you help my sinus problem? My answer is no, I don't treat sinus problems.
Once again, they say this publicly. I'm not sure if that's truly what they do in their office in the comfort of a private consultation, or if they might claim they are helping the patients. But publicly, they use this to avoid practicing medicine illegally. Because if they said, yes, I can fix your respiratory condition, or yes, I can cure your intestinal issues, that would mean they are offering a treatment designed to alleviate, heal, or cure a disease. And in those years, that would have been considered the illegal practice of medicine.
What can you do for my sinus? Nothing. I don't treat sinus problems.
What can you do for my cold, Reggie?
Not a thing. Not a thing. Here's what chiropractic is. And I explained to you that my job is to examine your spine to see if you have a good nerve supply to all of the organs, including the sinuses and every other part. If you don't, if your nerve supply is damaged by this misalignment of the spine, my job is to restore nerve supply. Now, will that help my sinuses?
Yes.
I really don't know, and I don't care.
Okay.
One thing I do know, you shouldn't be walking around with your nerve supply damaged. Whether it affects your sinuses or not, you don't need damaged nerves.
Notice how predatory it can be. This kind of talk can easily scare someone by saying, oh no, I don't want my nerves to be blocked, causing me to develop chronic illnesses over time and die sooner. I'll listen to this doctor and get treated. Maybe it will help my respiratory issues, my gastrointestinal problems, my acid reflux, my headaches, my child's colic, their ear infections, and at the very least, it will be preventive to ensure I don't damage my nerves and keep my health optimal. It's predatory. It's charlatanism. And this kind of rhetoric only benefits the practitioner and their wallet, not the patients.
My job is to correct nerve supply in all people under all circumstances, whether it affects your sinuses or not. You're better off with a good nerve supply. That's the position of chiropractic. And that's what the practice is.
It seems like a simplistic one, but a one that's been questioned.
It's indeed very simplistic, but simplicity is what patients understand the most because it's a message that's easy to grasp, using commonly understood terms in a very straightforward way. This makes it more accessible and easier to comprehend. The approach is to craft a message that resonates more with people rather than a more complex discourse filled with uncertainties representing traditional health care.
Yeah, it's simplistic in the same way that good nutrition is simplistic. I wouldn't offer good nutrition to cure your cancer, but I say this, if you have cancer, you're certainly better off eating properly rather than eating poorly. But if you don't have cancer, you're also better off eating properly than eating poorly. The same is true with chiropractic. Regardless of what disease you have or don't have, you're better off if your nerves are not damaged by vertebral subluxation.
Once again, a clever mental gymnastics. We talk about nutrition in relation to cancer and overall health and compare the general benefits of eating well, which has proven advantages for the body, to a pseudoscientific concept that has not been proven and still doesn't exist today. Nutrition has similar benefits for the body as physical activity and movement. A person who moves more, who exercises, does strength training, or increases their cardio is benefiting their body, not chiropractic subluxation.
Dr. Grant, if I come into your office, I don't know, I'm calling you Reggie, I'm calling him Terry.
Oh, that's okay. My name is Reggie.
Okay.
Dr. Gold is my wife.
Okay, fine. Jack, if you please.
Right.
Okay. I came into your office, or if I come into your office, I have a cold, I have a sinus problem, upper respiratory, what would you do?
Well, I would talk with you for a few minutes to get the symptoms. Then I would look at your head or your eyes, your ears, or whatever seemed to be appropriate. If I thought that you might have if I wasn't sure, but I thought you might have a sinus infection, I might get a sinus x-ray.
What he's talking about here is the clinical process to better understand the history of the problem, then conducting evaluations to confirm or rule out differential diagnoses, eventually reaching a final diagnosis. From there, an appropriate treatment can be prescribed or recommendations can be made for home care if no treatment is necessary, as the condition may improve on its own with a conservative approach.
Or if I thought you had a strep throat, I would get a throat culture, maybe a white count, and then I would treat what seemed appropriate.
Okay, Dr. Williams, from another medical standpoint, would you be checking my spine? Would you be checking my nerves for my cold, for my sinus, my upper respiratory condition?
No, I would not. I think that
It's pretty funny when the technician sneaks in the middle of the video and thinks, oh wait, this might not be the best time to be here. See ya.
scientific fact bear out that there is no real scientific basis for the practice of chiropractic as such.
Indeed, examining the spine in cases of upper respiratory infections or respiratory diseases is not consistent with the scientific evidence of that time, and even less so with the current scientific evidence.
I agree with the theory that any damaged nerve to a part of the body can cause a disease of that part, and some of the medical physicians' treatments are based on that particular premise also.
Indeed, when a nerve is damaged, whether due to a spinal lesion, a hernia, osteoarthritis, infection, a tumor, etc., it will affect the functions of that nerve, such as sensation, muscle strength, and reflexes, rather than awkwardly affecting organs elsewhere in the body.
I would like to ask Dr. Romberg if there are ever any spines examined that are found to be perfectly normal.
I guarantee that the answer is no, but the public answer will be yes. If you'd like to see the continuation of the documentary and hear my perspective on it, the next part should appear live here. In the meantime, feel free to share your story, comments, suggestions, or any remaining questions.